everyone. My name is Jonathan Likes, and I'm a policy analyst at the Center for the Study of Social Policy. Along with Tashira Halliard, I work on the Alliance for Racial Equity and Child Welfare. On behalf of the Alliance and CSSP, I would like to welcome you to this afternoon's webinar, focused on the importance of data collection and analysis in system efforts to eliminate racial and ethnic disparities. This is starting with the numbers. The webinar will get started shortly, but in just a few moments, I have a few reminders for everyone. We recommend that all participants dial in using a landline to improve your sound quality and to avoid any connectivity issues. If you do have an issue with sound quality, please hang up and dial back in, and that should help fix the problem. If you have any questions for our presenters, they will be answered towards the end of the presentation. But feel free to submit questions at any point during the presentation. You can use the question feature in the GoToWebinar control panel. Also, this webinar is being recorded and will be publicly available after the webinar. The link will be shared via email to everyone who has registered for the webinar, and we'll also send along a PowerPoint for all the presentations that will be presented today. A final note is that we also have live captioning on this webinar. We will be sending out a link to everyone's chat box. So if you're interested in viewing the live captioning function, please look for the link in the chat function. The mission for the Alliance of Racial Equity and Child Welfare is to promote leadership and provide information and support the elimination of racial disparities and improving outcomes for children and families of color who are involved in this nation's child welfare system. One of our primary goals is to help individuals and organizations further their understanding of the nature and extent of the racial disparities that we see in our systems. I would like to now hand the microphone over to Janice Grandel, and she's going to give some context for what's been going on with data collection and analysis in system efforts. Janice?
Thank you. I will speak on behalf of myself and also my partner, Joyce James, with whom and Tashira and Arandi Miller, for that matter, in the first year of this work, we've worked together with probably a good number of you that are on the phone call to bring forward challenges and issues related to assuring that the child welfare system is ready, willing, and able to create conditions of racial justice within itself and among its partners. At the end of our first year of that work, Joyce and I talked individually with a group of folks who were regular participants on a series of phone calls we did monthly together. We wanted to learn what had worked for them, what we could do differently and better, and what topics we would want to explore, you would want to explore with us in the coming year. Topics that came up again and again included the following: data as the base for policy review and practice change, state-by-state stories of challenges and successes, specific policy and practice design issues that you were in the process of changing, leadership strategies and challenges, especially when senior leadership changes in an agency along with elections and other events. And then lastly, connections between child welfare and disparities that we also see among this group of children and their families in the context of health and also education. When we had finished that round of conversations, we had accumulated a set of recommendations made by participants, and Joyce and I contributed to. 3 of these suggestions are relevant today. One was to allocate a little more time in the sessions. We had been using an hour and we never quite got finished, which was a good thing. Secondly, to meet using these forums every 6 weeks instead of 4 weeks, which would allow us to spend a little more time each time. And then lastly, to include webinars and other presentation tools, we had limited ourselves pretty much to phone convenings. So our session today is the beginning of this new series, the new year's worth of series of convenings around the issue of racial justice, and we're able to accommodate 2 of these recommendations right off the bat, a longer period of time and using a webinar presentation. With that as a very brief context, I am so incredibly pleased to introduce you to Deputy Commissioner Michael Williams from the Connecticut Department of Children and Families. Michael is a longtime friend and colleague. He and the DCF team have prepared a great presentation, and it will be, I think, incredibly revealing, and it takes us to the first issue, how we can use data to make substantive and very important change. Michael and your team, thank you and welcome.
Thank you, Janice, and we're grateful for this opportunity to present to you all. I'm Michael Williams, as said, and to both Janice and Joyce as co-chairs and the Alliance members. We're grateful that you've asked us to share the Connecticut story and what we've been doing here as it relates to our journey to achieve racial justice within child welfare by eliminating disparities. As mentioned, I have a team of people who are here who will be presenting with me, who will be doing the bulk of the presentations actually, because they have been instrumental in helping us move our system forward. And we are, eager to engage you all in conversations after we present for about 40 minutes, 45 minutes about what we've done. We would like to hear from others about things that they're doing and to share some areas of success you've had so that we can continue to grow here in Connecticut, because we know our journey, though we've come a long way, we still have a ways to go. And so let me start with an introduction of who we have here and who makes up the Connecticut team. Starting at the top right is myself. Next to me is one of the co-chairs of our statewide racial justice effort here in Connecticut, Vanessa Brown, who happens to be a regional administrator and part of the senior administration team of the department. Next to Vanessa in the corner is a consultant that we brought on, an external consultant, Jenna Dusty, from a consulting firm. Down at the bottom underneath me is the director of our Academy for Workforce Development, Jody Lilly. Next to Jody at the bottom is our Deputy Commissioner for Quality and Planning, Susan Smith, and a critical person who is not with us, unfortunately due to personal reasons, but is a critical leader in this work, is our second co-chair of the statewide work, Bill Rivera, which is on the end. And then in the middle is our commissioner, who joined us in the middle of the work, and she'll talk a little bit more about her efforts and directions as it relates to this. Joette Katz is in the middle. So let me just share quickly what you're going to hear from us by way of this presentation. We're going to have a quick conversation around the foundations of this work and how we had to establish a good set of foundational pieces in order to move this forward. Jody's going to talk a bit about that. Then we're going to give you an overview of the timeline of work we did pre-Commissioner Katz, and then Commissioner Katz will come and share with you her views and directives on this work, and following that we'll talk post-Commissioner Katz in regards to another set of timelines of the work. When that's over, we'll have a conversation around how we currently look structurally and the work that is occurring. And then we will finish the presentation with a very, I think, exciting conversation about how we shift it now to data and quality to move our work forward. And so when we started this, we were clear that in order to be successful, this work had to be broad and deep. Picking up on Dr. King's cliche that an injustice anywhere is a threat to justice everywhere. And we realized we couldn't pilot this in certain places when we knew that disparities exist throughout the state. So we had to take a broader approach to this and take a statewide look at eliminating disparities. And we realized we had to go deep. And so going deep for us meant it couldn't just be frontline staff concerned about this or top-level executives concerned about it. It had to be everyone. So from top to bottom, we had full inclusion, full participation across the entire department, ready to work on eliminating disparities based on race and ethnicity within our system. And so after having that, then we had to really talk about the foundation that we're going to build it on. So I'm going to turn it over to Jody Lilly, who's going to share the work we did there.
Thank you, Michael. As Michael mentioned, we have been very purposeful and strategic about weaving this work into the fabric of our culture. We did this by utilizing the implementation science framework. Many of you may be familiar with the National Implementation Research Network. We think that this is a great example of this framework, in that we wanted to make sure that this initiative would stick, and it would be one that would be present beyond the leaders that are in place at this time. And to do this, we had to build this into the infrastructure of our work and maximize the skills of our staff. So as you can see from the framework, on the competency drivers, we were very purposeful about the selection process. So we had leaders appoint staff from all levels. And in one situation, for example, we have a clerical person who was representing an office up to the level of regional administrators. And we not only did training because we know that training in and of itself does not change cultures. In fact, the research is very clear that people retain probably about 20% of information obtained in the classroom. We decided that we wanted to have coaching along with our training. And that has proven to be extremely successful, in that we just recently put out a request or an offer for staff to receive some coaching, and we were very surprised and happy to report that even though this was a voluntary option for our leaders, over 85% of our leaders responded to this request. To me, that's a conversation changer, and that leaders are very vested in this initiative and are willing to do this work differently. On the organizational drivers, again, we were very strategic to partner with stakeholders in the community and inside of our agency. I recently participated on an interviewing panel for an IT manager, and one of the questions in that interview process was, how would you build an IT system to make sure that we're capturing disproportionality? And so we have been very purposeful about what we're doing in terms of putting it into the infrastructure of our work. We have created a structure whereby all policy must pass through members of the Racial Justice Committee, so that we can make sure that any policy that is put into practice has a racial lens to it. And on the decision support and data system, you will hear from our Deputy Chief of Quality and Planning around how we're developing this infrastructure to make sure that this work actually sticks and is built into what we look at in terms of outcomes for our kids and our families. Later in this presentation, you'll hear from our commissioner about what leadership did to set the tone for this work, and under the framework of HIFITS and adaptive leadership, what she did to give the work back to the people, set the tone, and then allow the people to do the work from the inside out. So you'll hear throughout this presentation how this work was embedded into implementation science very strategically. And as we know with implementation science, that the exploration stage or the beginning stage of this work can last a very, very long time. Real change really does take time. And so we started this work back in 2009 as a result of public attention received regarding some racial tensions in one of our communities. And then at that time, our Deputy Commissioner Heidi McIntosh solicited the support of the People's Institute to provide some training to key leaders inside of the agency and outside of the agency to look at how we were going to approach this work. There was considerable buy-in from the inside and outside, And then we had what happens notoriously, an administration change. I wanted to just say that it was the outside community folks who really were steadfast in helping us to see the need to continue this work. And so with the nudging from the outside and the buy-in from the inside, we brought the issue up with our current administration, who embraced it wholeheartedly. And so we're going to let her talk about how she began to, our Commissioner Katz began to embed this work into the mission statement and do what we call give the work back to the people. Commissioner Katz.
Thank you. Thank you, Jody. So when I came to the department, I was new to child welfare, but I had been in the criminal justice system. I'd been a public defender for years and chief of legal services. I was on the trial bench, and then for a lifetime I was on the Supreme Court. And so I saw from afar, and I certainly saw when I entered the system, the doors of DCF, it was readily apparent to me that children of color were coming in at a much higher rate than their white counterparts, even though they had the same characteristics. Their families have the same characteristics as comparable white families. And so as we started down this road, and clearly, as Jody said, there's been some work that preceded me, but one thing was very clear, and I saw this again through a lifetime of prior professional work, was about unintended bias, and that if we didn't address it, racial equity could never be attained. And cultural incompetence and racial bias, I think, become even more problematic or even greater factors when you combine those concepts, and they are quite real, with the definition, and it's generally pretty vague, of what neglect means. And that's what goes on at the agency, obviously. We're dealing with neglect. Of our 93,000 calls that come into the care line, and half of them properly placed with DCF, about 92% of those involve issues of neglect. So when you think about an underlying cultural incompetence and racial bias, an inherent bias, and you combine it with something that is by definition itself vague, and then you couple that with broad discretion that's generally allowed child protective service workers, and certainly in their interpretation of the term, you could have a recipe for disaster, and certainly our numbers reflected that in my view. And I think by looking at all of this, I recognized that it was really, I recognized how little I knew, and I felt I personally in the agency really had to get a much better understanding of the embedded inequities, how they evolved. Nobody intentionally behaves in these ways, but nevertheless they're there, and how they evolved and what were the consequences of all of this. We couldn't challenge them, and more importantly, we couldn't design a system to ensure that all children would thrive. So in terms of giving it the work back, because there's certain things I could dictate from on high, but this is not one of them. This is something that really everybody had to be a part of, and I think it really had to be almost not just a top-down, but really a bottom-up. And so we formed a community of practice, which is a standing committee within the department, specifically for our racial justice work, to raise awareness, to present disproportionality pathways data, to develop strategies, and to coordinate training to all employees, as well as working with our external partners, that is the people who serve our families. And we looked at a variety of data, referrals, substantiations, because again, it's at every point along the spectrum that we needed to be looking at what was happening. So from the first referral to a substantiation, to a case opening, out-of-home placements, lengths of stay in placement, residential placement, the kind of placements, and permanency. And we had to do this using race ethnicity as crosstabs for key decision points. And the goal of all of this was to identify specific policies and practices that could be contributing to disparate outcomes. And so the work had to be comprehensive, and it had to be infused again into everything we do, from trauma-informed care to engaging adolescents on identity development, to contract procurement language, everything focused on ways to correct what we knew to be inequities found within the agency and in the provision of our services. Also, this work had to be continuous, intentional, and not just another initiative. We're great at initiatives, but this, as you've heard, and I think I'm the third person to echo this, it really had to be a constant. And I also knew that this was going to be very challenging, that there would be people who didn't want to engage. Some would be afraid to. Let's face it, it's hard to acknowledge being part of a system that disproportionately negatively impacts the very people that you're trying to help. And it's particularly hard, I think, if the implicit biases behind the policies and practices are held not just by people of privilege. So we began this serious journey to study, as I said, the impacts of race and racism in our work, with a goal to cultivate and to sustain an environment in which employees, families, and all of our partners could feel safe to discuss the impacts of racism, power, and privilege on agency practice and on the personal lives of our workers and our families. So where did that go? Well, so at that point, I knew that we had a lot of work to do, and it was work that we couldn't do alone, frankly. And I think we've made a lot of progress, and certainly the agency had made progress prior to my arrival. But I thought at the time that if we're going to make real tangible progress, and everybody was looking at us to really do this, and frankly, I personally felt in some ways, was I being tested? You know, was this real? Was this real for me? Or is this something that I was just going to pay lip service to? And it was very important that people understood how very real this was for me. And so I needed a partner, and Jenna Dusty of JRA Consulting is our partner, and she has really helped us along the way. And now I'm going to turn it over to her to tell you what she's done and how we've partnered.
Thanks, Commissioner. So I feel like I'm going to use a lot of the same words that that my teammates in Connecticut have been using all along, which are things like purposeful and intentional and really constant. Because I think all of us, when we were talking about this work, felt really strongly about all of those principles behind it. And what I wanted to highlight from what the Commissioner discussed is really from sort of the outside consultative perspective, something that I thought was a really incredible evolution that Connecticut did that's really worth noting for other places who are working on issues of disparities and disproportionality. And the conversation goes something like this. It's about language. And really we started, I think, with the conversation about diversity. You know, there were a lot of isms. There were even action teams already existing in Connecticut that were called diversity action teams that were doing some magnificent work. Some about race, some about culture, some about ethnicity, some about all the other isms that are out there. And through a lot of conversation early on, the group sort of said, okay, it's necessary but not yet sufficient. And then we moved into a conversation about cultural competence and what that meant. And as the Commissioner was describing, sort of where were the lines between this cultural competence and cultural responsiveness and impact and what was happening, what we saw in the numbers that was happening. And we again said cultural competence is certainly a piece of it, but it's not all of it. We then looked at a lot of data, as the Commissioner talked about, and really had some robust conversations about disproportionality and disparities and what that really meant about outcomes and numbers and data. And we said, well, the disproportionality and the disparities, that's the problem, but that's not the solution. And if we talk just about disproportionality and disparities, we're always going to be focused on identifying problems as opposed to driving towards solutions. So we then went to a conversation around equity and said, is this work really about equity? Is it about really figuring out where the opportunities need to be found and where sort of the proverbial playing field needs to be raised, not even equal, but where it needs to be raised. And we said again, it's getting closer but not quite there. And the Commissioner then the Commissioner and the leadership team at DCF did what I actually still think is a really bold and brave statement, where they said, we know all these other words are out there in the lexicon. We know for years and years people have talked about race with sort of almost all these what I would consider code words, but they haven't yet started using the word race. And they said, we want to put a stake in the ground, and the commissioner said, to move this work forward, let's call it what it is, let's call it what we're really striving for, let's name it racial justice, because that really is what we're talking about. And it's not to say that all the other issues aren't critically important, and it's not to say that, you know, some isms take precedence over other isms, but it really is to say, if what we're hoping to really focus on is race, and what we really want is justice, let's call it racial justice, and let's move that body of work, let's make it intentional and purposeful, and make sure that it stays long after there's another leadership change. So that's sort of my reflection on some of the big decisions that I think are important noting, because I think a lot of places land in one of these other boxes, and it's fine maybe for some places to stop there. But Connecticut said to do this work and to take the journey that we really want to go, we're going to call it what it is, which is racial justice. So Vanessa, can I turn it to you for talking about what that meant in terms of the timeline?
Absolutely. So the commissioner then memorialized this commitment by issuing in 2012 a DCF, or Department of Children and Families, racial justice statement, in which that gave leadership endorsement to the work that we do. From then, in June of 2013, we included racial justice as one of the 7 cross-cutting themes that were added to the department's overall infrastructure, to give it its own place amongst the very important issues that guide the practice of our work. That next month, the Racial Justice Work Group was created, and you heard people talk about the appointed representatives from not only just our central office, but our regional offices and our facilities and division leaders, to really have people sitting at the table who are decision makers around how we look at this work through a racial justice lens. From that, the work group started to get busy and do its work. And we realized that towards the fall of that year, in November of 2013, that subcommittees specific to certain areas of practice had to be developed. And you'll hear a little bit more about what that is and who the work of those groups. From there, we circled back to our senior administrators in January of 2014 to check in and to make sure that this group was still on target with what the commissioner and leadership charge was for us. At that point, and the internal work group continued to work and continued to be very diligently meeting monthly with Jen, the consultant, and with representatives from the divisions and regions and facilities. And then in August of 2014, we presented, or we went back to the expanded leadership, and we asked each of the regional administrators, facility and division heads to present what they had been doing in their respective areas. It was clear to us at that particular time that we then had to take it up a notch. And from there, in 2015, when the department's operational strategies were issued to all of those groups, performance expectations about the infrastructure of our work were highlighted, and performance expectation number 3 was very specific to achieving racial justice across the DCF system. We were very purposeful about our language there, because it wasn't a reduction in disparities, it wasn't a decrease in disparities, but it was our overall goal of achieving racial justice that we wanted to come across loud and clear. That particular performance expectation has carried us also over into 2016. But the thing that I also think is paramount to understanding how we do this work and the broad and deep tasks that we have in front of us was the inclusion of our external stakeholders. So in June of 2015, we held a kickoff event in which our larger provider network, our sister state agencies, representatives from our courts and different systems from across the state came and met with us, and we shared in a very transparent way where we were in the work that we had been doing and where we'd like to go. And we basically said to them, we need you to partner with us. We asked them to be part of our statewide racial justice work group, or to be part of those subcommittees, or even be a part of the regional subcommittees that were happening across the state. So from here, I will transfer this over to the director of our Workforce Academy again to talk to you about what some of the key components of our focus has been since that inclusion.
Thanks, Vanessa. So as you can see, we were very committed to this just not being us talking the talk, but walking the walk. And this involved a clear declaration and sponsorship from leadership. However, as the commissioner said earlier, it was a top-down, bottom-up approach. We were very committed to this work in that, you know, they say put your money where your mouth is. We actually funded the consultation. We are looking at our procurement of services. So all around, we are building this initiative into our everyday work. Aside from that, you know, in the busy work of child welfare, it is hard to really take the time to actually invest in this work. It takes time to change, and we have to allow staff to participate in initiatives such as this. Our racial justice work group meetings are very well attended, and staff have really committed their time and energy, and it's something that is a dedicated topic at all levels of leadership. The conversation around the data infrastructure, that really changed our conversation. I have to tell you, as you have data in front of you, what happens as leaders and people in all levels of the department, the data becomes embarrassing. And so when it changes the nature of the conversation, and that's what data did for us. And so data may have been the conversation starter, but this conversation also is a personal, it calls for a personal change for all of us. And so Jen is going to walk us through what she did with the work group to really prepare the staff and champions of this work to have these discussions with staff at all levels throughout the department. Jen?
Thanks, Jody. Well, first of all, the one thing I have to correct, because I never correct Jody, is that Jen really didn't do anything. This is really very much a team effort. And we, as a leadership team, we had a tri-chair. We have a tri-chair for the Statewide Racial Justice Work Group. As you saw in the slides, it was purposeful. Continues to be a Black woman, a white woman, and a Latino male, surrounded by our other leaders of various colors and races, and we went in very strongly with the sense this is not an issue that was going to be led by Blacks, and this was not an issue that was going to be led by people in privilege or power, but this really was going to be an alliance and a true partnership every step of the way. And as a result, we actually felt like there were sort of 5 different areas that we would always continue to work at the statewide racial justice work group level, and part of that is because, as Jody alluded to earlier with this coaching, knowing that many of our work group members were going to serve as essentially de facto coaches in their home area offices and regional offices as well as central office. So almost at every single monthly meeting, we had a combination of activities and conversations, and what we included was always a focus on awareness. And it was awareness in all the different areas that the commissioner mentioned, ranging from implicit bias to institutionalized and systemic racism, to conversation about data, to conversations about internalized racism, assumptions. We really ran the gamut and continue to explore our own beliefs as well as those around us, and constantly really driving home the fact that we can't continue to do this work and we can't really authentically do the work unless we're constantly aware of our own feelings and the world around us. To do that, we also have talked a lot about safe spaces, and to steal language from, I think it was Orande, I first heard it from probably back in about 2005, making a distinction between safe and comfortable, that the conversations would be incredibly uncomfortable, but as long as the space was safe, we could have horribly uncomfortable conversations, but we needed to get away from this notion that spaces weren't safe just because they were uncomfortable. So we constantly strive to create those, but also to teach our work group members of how to do that back in their own respective areas. We do all of these things through really leading provocative and very intentional conversations. So every work group meeting has some activity infused into it where we spend time having some raw discussions and then really stepping out of time and talking about what that meant and how we did it and how people felt and what they could carry forth to take back with them. We always connected the work to overall good practices. So, and I'm going to tie these two things together, these last two issues around race-specific practices and overall good practices, that sometimes we hear sort of not a contrarian viewpoint, but a converse, I guess, maybe to what we say of, we don't want to just focus on practices that are just about race, but we believe that there are some things that tend to be a little more race-specific, and those probably fall into that broad categorization of what some people call culturally competent practices. And I'll throw out some of the things that, this is just Jen now talking, my belief of, you get into things that are more race-specific practices when you get into cultural and family norms about things like fatherhood engagement, kinship care, some other child-rearing practices might tend towards that part of the continuum of race-specific. We also believe, however, that if we do all of these things well, we actually will be just contributing to this overall body of overall good child welfare practices. And we just made distinction on the slide because we don't want to talk about just one or the other, but really want to tie both of them together in the context of all of these other things relative to race and justice. And I believe, Jody, I am turning it back to you to talk a little bit about how the statewide racial justice work group is actually organized to do this and take back some of what we do at the statewide level.
Thank you. So in the interest of time, I'm going to speed through this, and hopefully we can use some of the question and answer into if you have specific questions. But again, there were 4 subcommittees that were developed off of the statewide group, one to focus on policy and practice, one to look at workforce development, who are we hiring, how are we disciplining staff at different rates by race. We looked at our procurement process. Are we making sure that we're providing culturally relevant services? And we strategically partnered with our community. And in fact, one of the strategic partnerships was with our courts, and our chief of quality, our now chief of quality, Elizabeth Duryea, was on the other side of that equation at one point. She now works for us and continued this conversation now in her current role. But we understand the importance of partnering with the community and getting that message out to the community and having them work with us. Quickly, Vanessa is going to talk. We want you to hear from our chief of quality, so we're going to speed this up so that you can hear from her. But first, Vanessa?
Yep, so how this work looks at a practice level, we spoke already about the structure of our operational strategies and performance expectations, but our agency work cuts across not just the regions, but also our facilities. The awareness activities go beyond just workshops on cultural humility, implicit and explicit bias, to really taking a self-awareness look and worldview at things. We have things like think tank consultations and really understanding that in order to embed this, it's not just extra work, it is the work. And in ways that have to be reiterated to our staff in terms of all of the decision-making points along the continuum. All of our policies and practice guides are being now reviewed through a 5-point equity analysis framework designed to ensure that our system and practices are not contributing to additional disparities and disparate outcomes. Examples of that are our early childhood practice guide and our trauma-informed care practice guide that provide frameworks for really understanding how race, culture, and language have to be considered when assessing the impact of trauma on our kids and considerations for case planning and placement. Lastly, we also have an opportunity to look at how we talk to and engage families by embedding specific questions along our protocols and processes to engage clients in conversations about race and ethnicity to obtain more accurate self-disclosure and consistency in our racial data. So all of this allows us to begin to examine data from a more critically racially just lens. One of the models that most of you have probably heard of that we've been used throughout, that we've woven throughout the course of our work is results-based accountability to really have us focus on an attention to our outcomes. Our Deputy Commissioner of Chief of Quality and Planning, Susan Smith, is going to walk you through what we ask ourselves as we look to analyze our outcomes.
Good afternoon, everyone, and thank you for inviting us and allowing us to tell our story and to share some of our data. As Vanessa indicated, results-based accountability has been one of the foundational quality assurance frameworks for the department. We've been working in that arena for a number of years and felt that this was a basis for us to really think and look at our data very differently. So folks are certainly familiar with the 3 core RBA questions of how much, how well, is anyone better off? And it kind of dawned on us that we needed to think more than just is anyone better off, but who is better off. And I think that really allowed us to look at, to embed a racial justice lens into our work. For example, all of our program leads are expected on a quarterly basis to develop RBA report cards. And so by including this 4th question about who is better off, that did require that the data is analyzed in that way, disaggregated in that manner, and that when folks are talking about the story behind the data, when folks are talking about how to turn the curve, that is an integral part of the strategy and the development. So that for us really has been simply a game changer in terms of really getting that to the core of the work that we do, particularly on the data side. One of the foundational data presentations is what we call our disproportionality pathway. Folks who have seen me present know that this is probably one of the slides that I pull out every single time, and I think it has such great relevance to everything that we do as a department. Walking folks kind of quickly through this, what it shows us is the representation of the general children's population in Connecticut. The green shades are children of color, African American, and Latino children. African American and Latino children are about 30% of our population, yet they are well over 50% of the kids who refer to the department. So about 54% of the kids referred to our department are children of color. And if you were to go across that pathway for most every decision point, children of color are overrepresented. So 54% in some instances, 52% in terms of the substantiations, 56% in terms of the kids who enter care, 57% of the children who are in DCF care, and it balloons to 60% of the kids who are in congregate care settings. So certainly this has just been a real sentinel document and a real sentinel piece of information to really let us see what's the impact of when kids are presented to the agency, and what does it look like as they start to pass through through the agency. And this is actually one of actually a 15-deck slide presentation that we have on the pathway. So I just literally pulled out one of the slides, and we've been doing this for probably about 3 or 4 years. So going back to, I want to say maybe 2012, we've been looking at our data in this way. We also break it down by each of the area offices and regions. So this is the statewide representation, but we also do it at those more local levels. So as my colleagues noted, when we're looking at our performance expectations, when we're doing this work, we really can pinpoint what's happening and react and intervene in a very local and area office and regional specific way. We're also looking at using this pathway model in other ways. So on the JJ side, we've just actually created a pathway that looks at kids in our JJ system are committed delinquent kids and how they're faring at different points, and are they having progressive moves, and other things in our system. We're also looking at creating this for our court decisions and how that potentially impacts permanency. And we're looking at it in some other ways to really give folks this kind of almost like a multitasker, all-inclusive lens about what goes on with the children who come to our attention, and again, specifically through that racial justice lens. Connecticut, as folks may know, is a consolidated child welfare agency. So in addition to having responsibility for child protective services, we also have responsibility for juvenile justice, children's behavioral health services, and prevention, to name a few. And so there was also an incumbency for us to look at our JJ data, as I indicated in that previous slide, where we're looking at that specifically under the pathway modality. But we've just been looking at this generally in terms of, where kids of color fall within various status types in our agency. And as you can see from these data, that children of color are greatly overrepresented in our juvenile justice ranks. You'll see this amplified in some additional slides, but again, this is one of those things that we knew we had to attend to, and in which we really need to be looking at more carefully. The next slide is arrest data. And this actually comes from what we call our risk management database. And what this represents are the children who are receiving services in a DCF-funded congregate care setting or other service that the department provides, such as therapeutic foster care, and the children who are arrested at some point over the course of the period, in this case over the calendar year. And as you can clearly see from these data, that African American children in particular, but African American and Latino children are more greatly arrested in these settings than other kids. When we looked at the JJ pathway that we're creating for those committed delinquent children, who again are overrepresentedly children of color, once again, the kids who were being arrested at some point were much more greatly those children of color. I think in that instance it was over 80%, close to 90% of the arrests were children of color. So clearly an area of interest and an area for which we need to be attending. Just a real kind of quick story about kind of this risk management data. When I was looking to run this, it's an old Access database, so it gives you a little context about kind of how long ago this was created, but we still are using it and are maintaining it. And there were a slate of CAN reports, and so I was like, okay, you know, let me look for the race and ethnicity CAN reports, and I saw gender, and I saw things related to age. Could not find a race and ethnicity CAN report, and so I talked to my staff, and they're like, no, it wasn't you. That had not been created back in those days. So it's just really, again, to me, just kind of amplified and just made quite clear for me is that a lot of progress has in fact happened, and there's no way in the last couple of years would we even consider standing up a data system or creating data reporting that did not allow us to readily and easily look at data and disaggregate it by race and ethnicity. So certainly quite eye-opening for me. This next slide represents our voluntary services. As I stated before, the department has responsibility for children's behavioral health services, and one of the features that we have as part of our system is that we're able to support families that have children with very, very complex needs and have a variety of cross-system service requirements. And so we will work with those families to support and ameliorate some of the children's behavioral health needs, and hopefully so they can be maintained in the home and the community. What we find, however, is that children of color, particularly African American children, are woefully underrepresented in our voluntary services ranks. So when you contrast that to our pathway data, the kids who come to our attention on the CPS side, when you contrast that to the number of kids who are JJ involved, it really is quite startling. This was just a form of our information that we hadn't looked at in the past. And really, as folks talked about, having these really courageous conversations, sometimes very uncomfortable conversations, and being empowered to look at our data in ways that we hadn't before, and being able to share this. So these are data that we actually shared at a public meeting, and that included some of our providers, because we wanted to have that conversation about engagement. We want to have that conversation about decision making. We want to make sure that we're supporting all of our families in a way that makes some sense. One of the things that I didn't include in this deck, but have talked about in the past, was some of the ACEs data that we've seen in the state, and recognizing that adults of color have a higher level of ACEs, adverse childhood events, than other races. And it then kind of suggests to me, I'm not a clinician, but it suggested to me that there may be these attending behavioral health needs and supports that children of color may have, and we need to make sure that the bookend of this, that thinking about ACEs and reverse engineering back to opportunities for intervention, intercession, mix and make sense, match and make sense. So this next slide is actually a pull of data from a data system that we use to collect our community-based services. The majority of the services in that system are behavioral health related. So what you can see here is that, again, children of color at least appear to be underutilizing these community-based services. So kind of taking a couple sentences back, I mentioned again the ACEs. I mentioned again, the pathway. One would expect that we would see a higher level of children of color using our community-based services, and we're not. And again, these were data that we presented publicly and talked with our providers about, because again, we really need to get underneath this. This again is also part of the discussions that we're having when we're looking at our RBA report cards. Adding that fourth question about who is better off really has allowed us to start to look at, are there pockets, is it specific services, is it specific providers, really allowing us to better get underneath why we're not seeing the utilization that we certainly expect and want, and helping us think about what are the strategies that we need to employ in order to reverse that tide. And my last slide is actually part of a dashboard that we've created. I did not include the panoply of data that we have. We're a state, I think we were one of the founding states who use ROM, the results-oriented management. So we have just a ton of data presentations under that system. And in fact, we just relaunched it, did a huge update of that system. And one of the suites of reports is actually disproportionality and disparity reports. So we're very excited about that inclusion. As well, if folks are interested on our DCF website, if you go to our home page to the far right, there's an icon. It's like a little speech bubble, and inside has a pie chart, and that's what we call the DCF Data Connect. And that will take you to a site that will link you to just myriad of DCF data, including a Connecticut Open Data Portal, where we have put, in some instances, about a decade's worth of unidentifiable data sets, so folks can run data and look at different aspects of our system. So again, just a lot of work has transpired over the past few years to really use data in a very meaningful way. But I include this slide in particular because some of the work that we've done in Connecticut over the past years has been to reduce the number of kids who are in congregate, and I'm pleased to say we've been very, very successful in that. When the commissioner first started, I think we had almost 30% of our kids who were in placement in a congregate setting. That's now about 11.3%. We also had a very small percentage of kids in relative and kinship settings. I think that was maybe 21% maximum. We've nearly doubled the percentage points of that. That's over 41% of our kids are now in kinship care. So, on its face, you could spike the ball and moonwalk off. But what we did is actually looked at some of these data, and this is one of those things where I would have lost my shirt on this. I would have just kind of gotten cleaned out. Is that we've discovered that actually our African American children are not placed with kin at the same level as their white and Hispanic counterparts. So white and Hispanic children are placed with kin about 30 or so percent. And African American children about 24%. And I think no one would have taken that bet and would have thought that. But that was quite, again, another example of the eye-openingness of not only how sometimes that data will kind of let you confront some of the things you don't want to know about, but this sometimes can also debunk. And for us, that's been really critical because as the regions develop their performance expectations, that's an area in which they're attending. So they're not just simply looking now about, okay, I want to get more kids and with kin, I want to reduce congregate. They need to be really thoughtful about, well, what's the strategy that I need to employ to ensure that African American children are getting into, not only are we reducing their likelihood of going into congregate, but we're placing them with family and kin. So that's actually a pretty significant finding for us. And for us, this journey and the inclusion of data and the empowerment to use the data, I think has just been tremendous and significant for us. So I'm going to lateral to Deputy Commissioner Williams to take us home.
And thanks, Susan. This is our final slide. As we conclude, we reflect on Susan's comments in regards to the data that she was showing you. Those are only a small percentage of a large amount of data we use in this work. We are very intentional about data because we know if we want to really not make this an initiative but make this something that's sustainable within the department, we have to, in a sense, infuse it in the bloodstream of the department. And in order to do that, we needed to get a good footing, around data and quality assurance. And so Susan has done that for us well. The data helps us to know better And now our question is, now that we know better, we definitely have to do better. And moving from a data-informed to now data-driven decision-making is a part of the process or the stage of the journey that we're on right now. So thank you for listening to us. That's the Connecticut story in a nutshell, 45 minutes. We've enjoyed sharing this. We're always excited to talk about what we're doing, but most importantly, we love to hear from others about what they're doing, and so that we can be a learning organization as well. Thank you.
Thank you so much, Michael, and your team. It's absolutely an inspiring story that we are learning from and will continue to learn from. So just as a reminder to all the participants in the webinar, if you have any questions, please shoot them through the chat app and we will read them off. We have a few questions in already, but I want to give Joyce and Janice a chance to add any contextual responses if they wish at this point.
This is Joyce James. All I want to add is to say thank you to the Connecticut team for the great work that they're doing and the great presentation, because it, the data has really served to inform you about where and how you have to focus and do this work, and to be inclusive of language that really gets to the heart of the issue. And I just want to applaud you for the work that you've done and for the great presentation today.
This is Janice. I would love to ask one question that reflects comments and that we heard in the first year of these convenings, and then also that we heard when we talked with people individually around the country. And it was their expression, quite poignant, of a sense of isolation in the work that they were doing within their state. It doesn't feel to me, based on this presentation, that that occurred in Connecticut, and I'm wondering if somebody could speak to that.
Sure, Janice. I mean, there was a time where we really had to go within to assure that we were ready to partner with others. I think that's a critical part of the process, self-reflection and being honest with yourself, and that required our ability to talk openly and honestly at a table and in a space that's safe, that Jen talked about, so that we'll know when we talk to partners and stakeholders and community folks who we engaged in this work, we'll know what our vulnerabilities are, we'll know what our strengths are, and we would have the courage to be transparent. And so it's always good to have the partnerships. I think you can't, as we know, you can't do this alone. Structurally, across all human service organizations, there's disparities and disproportionalities. We as a state have some of the largest gaps as it relates to quality of life indicators of disparities and disproportionality. So we know we need other players and other stakeholders and agencies to do this with us. But you just can't knock on the door and say, let's go, if you're not clear on who you are. And our work within was a critical step for us.
Fantastic. So now we'll go to a few of the questions coming in from the webinar participants. One is from Katrina Broussard. She's asking that, she says, numbers tell you where the problem resides, but do you follow up with qualitative data to figure out why disparity occurs at a specific pathway point? So question about qualitative data and how you collect and analyze that.
Sure. And I also have some other folks, who have been in, Vanessa, who's our regional administrator and who engages this work regularly. But from our qualitative, we have myriad kind of qualitative processes. We have a very comprehensive, for example, administrative case review process. And that we have about 50 or so dedicated social work supervisor staff who work with our staff looking at case plans and then going over our case records and sit down and do these about 15,000, I think, meetings that we do annually a year. That certainly is a part of it. Connecticut, as out there, we're an agency that has been under a consent decree for a while, so there's also qualitative reviews that occur as part of that. And we've also worked to just develop other kind of, I don't want to say kind of ad hoc, but qualitative processes that are kind of promote our research agenda for us to really get underneath certain problems. So, so our Office of Research and Evaluation has really been a critical partner in helping us to look deeper and more broadly at these particular issues. And so, you know, having the racial justice work group, the performance expectation work that we do, and we have these every week we have kind of a senior leadership meeting. Those are really kind of been some of the points whereby we're having these conversations, and we all kind of populate those various tables. So we're pulling that thread throughout. So that's really kind of what, you know, part of the partnering at a higher level with the qualitative and the quantitative data. But I think, you know, Vanessa can speak to it in terms of the performance expectations, because I think having folks really understand kind of how that works will better explicate kind of how that qualitative piece really gets operationalized.
Sure, because one of the things that I think we can guard against is the fact that when you look at it from a practice standpoint, when we start seeing data and seeing what the data is telling us, we have to guard ourselves against, analysis paralysis, in that more data and more questions just make the mountain seem insurmountable. But we then have to kind of take with the information that we have and really understand how it's impacting practice. So by way of an example, when you think about the disparate number of children of color, particularly African-American kids, in kinship care, we then said one of our operational strategies needs to be not only talking to our child welfare staff that are out there in terms of making placement decisions, but going deeper and involving our foster care support staff and actually talking to children and talking to them about who's around the table at Thanksgiving. You know, who did you spend time with last summer? And that really gets to the meat and quality of really understanding how we engage our kids and engage our families in a more purposeful way, guided by the data.
Thank you. Another question coming in from Shirley Kane asking, do you also have an equity committee at DCF to hire and promote and retain people of color in management positions there?
Hi, this is Michael again. Yes, we do have an Office of Diversity and Equity, formerly an affirmative action office that, you know, enforce the laws of equity and you know, affirmative action related to race and other kinds of diversities. They participate in this. We are, I think it was one of the slides, that we wanted to make sure that we didn't want the issue of racial justice to get lost in the overall conversation of diversity. And so we have a great relationship with that office, but we are clear in regards to the scope and responsibility of each.
I think it's also add, one of the things that we do have is that we have a requirement that there's a diverse panel of folks that are part of the hiring, which I think is actually a critical way of ensuring that that lens is also pulled through. When Jody noted about that there being that question about racial justice at an IT you know, manager kind of hiring, I think that really speaks to it, and that's something that we've been really adamant about, that is absolutely an expectation that we have to have a racial and gender equity representation on all of our hiring.
And Susan and Michael, go ahead, Jody.
I would add, part of what we're very sensitive to is that we want the population serving our communities in terms of our agency we want our agency to reflect the population served. And so we work very closely with our HR department to make sure that we have applicants with a diverse background to actually reflect the population that we're serving. And we're very deliberate about making sure, for example, we have a shortage of Black males and Latino males. And so that we in Connecticut do not have a workforce sort of recruitment issue. We have thousands of applications for one position. And so when we're going through the screening process, we'll make sure that there's representation from staff, from candidates, from the population that we actually serve. So we're very strategic about that.
This is Joey Katz. I just want to voice a word of caution. DCF is probably the largest employer of state agencies on a percentage basis of people of color. And I'm very proud of that. But clearly that doesn't immunize us. And so again, it's a word of caution because it's a different issue. It's very easy to say, oh look at all the employees that they have. They couldn't possibly have racial justice issues, and that of course is not the truth. Absolutely.
Another question in from Richard Hooks Wayman asking, how is Connecticut addressing the racial disparities in the reports made to child protection from community? In Richard's state, he's saying that they struggle with finding ways to stem the tide of calls made from schools and community members that result in more African American children being reported to child protection than white youth. How are you addressing this challenge that starts from this point of contact with the child welfare system?
You will see on one of our slides that we very deliberately, one of the very first things that we did was we got to our training component on mandated reporters, and we very purposefully included information about disproportionality. Now that's a fine line to toe, because we're not discouraging people from reporting child abuse and neglect. We're merely bringing data to their attention and asking them to critically think about that process. And so we have trained up our staff to have conversations about that pathway data that you see relative to the respective communities. But you're absolutely correct in that the entry into the system starts with the folks in the community. So we are really training our staff to really have those conversations with our community providers as it relates to mandated reporting.
Another area that we chose to focus on, and we are really deliberate on in our training and communications with the community, is to highlight the fact that if these disparities exist for kids of color, the flip side of that is also, are there other white children who are not getting reported to the department because people are making assumptions about their safety and well-being that just aren't so. Even when we look at special reviews after fatalities and we look at those through a racial justice lens and determining whether or not reports should have been made or could have been made from members of the community, were there assumptions made just because of the race of the family?
Yeah, and actually in one presentation that we had from one of our communities, we had people of color underrepresented. And so the data was very interesting, and so it begs the question about, are we adequately and appropriately referring kids who need to come to our attention?
It also, this is Joy Katz again, it also highlights for me the need to work with other systems because, you know, certainly schools historically either would call DCF or 911, and so you had a huge spike in arrests. And it's about letting hospitals know, schools know, providers know that there are other options. You can call 211. You can get EMPS if behavioral health issues arise. It doesn't always have to be a call to DCF.
We did a very interesting thing, and we started asking for the race and ethnicity of the callers, just so that we can begin to gather some information about that. And so we're trying to get our arms around who's calling, and if the and when we get not accept, do we need to do some outreach around appropriate recalls to the community?
Thank you for that. That's very, very helpful. A comment and then a question on kinship care and the kinship structure. There was a note from Marva Lewis saying, going back to the using data slide, she's giving a comment on kinship care. She's saying the speaker was shocked. And she says, remember that African American kinship structures are also disproportionately represented in all the other inequities that put strain on families, such as incarceration, low income, income inequality, education, etc. So she supports kinship care being the first choice, but additional resources should be incorporated into those placements. So you can respond to that comment, but there's also a question also. What are some of the reasons that African American children are placed with relatives at a lower rate than other groups?
That's the first part of it, and I think that that's actually, you know, kind of to the point. And I think that, you know, we have been very good about trying to make a great deal of resources available to families across the board, and I think it was just kind of a reflection of, we have that, and we have, some of the, other kind of, even kind of biases of what we might think about kind of the rates of placement, and we didn't see that, coming to fruition. And I think that for us, that was important information for us to see, as I said, to really, kind of debunk and rock us from our, I think maybe a little bit of our complacency in terms of thinking that may normatively have been happening. And so I, certainly appreciate and, and agree that we, need to make sure that the resources, if that happens to be the need, is in place, and that there aren't other biases also that are impacting that occurring as well. So I think that's been one of those areas that we really needed to get underneath and make sure that we weren't introducing other issues that were thwarting our ability to get the level of kinship placement that we want and had hoped we were getting.
I would say some of the reasons why not is systemic and historical. I mean, when you think about those who have histories with the department, a call, I mean, 90-something% of our cases are due to neglect, and 20-something years ago, many families got reported on, and so history is there. And I think when people are having to make kinship placement decisions in light of histories that in the 20 years ago they spoke of neglect, but really were due to other kinds of issues, it creates a level of hesitancy, and it takes a lot more time. It's a critical thinking process that one would have to go through, a full analysis of it, and sometimes without the benefit of time, people move on. And the work of this work group has been one to keep the data in front of everyone, to say, this can't, we can do this. It's just going to require that we look at our practice a little differently.
Inherent in some of those decision makings had to really look at our practices and our structure around even licensing of relatives. And when you look to reduce the number and reliance on congregate settings, and if we say that our value is for children to be with families, we had to look at how we were licensing relatives, how we were excluding people, how we were counting previous history with our system, and really call it out. If we thought that there were issues of values and judgments and bias being made at the decision-making point, call it out to the place at which it really did impact particular cohorts differently. So the data is informing us, but it's also helping us shine a reflection on some of the things that we have done as a system to unintentionally contribute to some of that.
Thank you again. Can you all speak a little bit to the notion of intersectionality, this idea that race is always intersecting with various identities that young people are experiencing? Can you speak to that a bit?
I can from a practice standpoint, and also from an awareness issue. When we have brought in various consultants across the department to really talk about issues of race and identity, we were very purposeful to understand that race is one of those carve-outs that tends to happen, particularly in a state like Connecticut, where the achievement gaps and income gaps tend to be very disparate. But we as a group were very purposeful at bringing race back to the forefront, because when you control for everything else, we continue to see disparities related to race, unlike any of the other variables that you could factor in. So although we understand intersectionality and the influence of various other factors in decision making, we also know that when race is kind of put to the test, the disparities are so much more greater and so much more glaring in terms of our decision making.
Thank you. Shirley Kane is asking, will you all be doing any specific interventions to address the high rate of out-of-home placements?
I think the interventions that we are doing or that will be done now that we have this critical focus through the data is, within the regions and offices that are doing the practice, they have to create specific strategies to their particular child in placement population. And as we see disparities that exist, we have in Connecticut at the executive level, a quasi-child stat process where facilities and regions create an annual plan on how they will operate and achieve performance towards 5 expectations that the commissioner lays out at the beginning of each year, which we call the performance expectation. We talked a bit about it, and one of those expectations is achieving racial justice. Every quarter, they have to come and report on the progress they've made with data, achieving racial justice in those various areas. One area that's very clear is the child in placement rates, and seeing whether or not children of color are experiencing permanency at a faster rate than before, because that is one of the factors that we know that was contributing to our increasing rate of children in placement being children of color.
Another model that has been instituted under this administration is what we call the considered removal conversation that we're having with families. And under the considered removal structure is simply this. Prior to the implementation of considered removal meetings in which family members bring their support to the table, we might just show up at their doorstep with the police to remove the children. What happens now because of considered removal is that families bring around the table people who are their biological kin, but also fictive kin and supports that they have within the community to really talk through and help mitigate the safety factors that have us on the threshold of removal. The other thing that we had to do is once we implement a system like considered removal, we had to examine whether or not our kids of color were always getting those considered removal conversations at the same rate as their white counterparts, and then if not, paying attention to what that meant in terms of the amount of children that were being diverted from coming into our system. And we have found particular success around having considered removal conversations at the point at which we would ordinarily just be making the decision to remove children.
Another follow-up question that Julia Wolhander is asking, kind of on the topic of intersectionality. She says, how are you ensuring that other issues are included when collecting data and analyzing it to eliminate racial and ethnic disparities, such as kids of color who are disabled?
I want to make sure I understand really the question, but when I talk, for example, about our administrative case review process as one of the examples, that's actually a pretty comprehensive look, and it's really predicated on much of the CFSR as well as some other kind of homegrown issues, and we're really looking at kind of myriad things that impact the needs of a child and a family. So, from that qualitative side, that does allow us to get a little more finer distinction. Generally, when we're also, from our kind of quantitative side, we also have tried to do a pretty good job of trying to have a variety of filters and data items in which folks are able to drill down upon. So just how we create, kind of create our data, sometimes, some of those variables are not always as easy to glean and are needing to be put together. But generally speaking, when we're doing our higher level, fairly complex analyses, that's the type of work that we're doing, that we're looking at a variety of different data points and really trying to get underneath it. Our Office of Research and Evaluation has a dedicated PhD level statistician, and part of our formal analyses, we really are looking at a variety of multivariate items and really looking at statistical significance and intersection of some of those things. So we're looking at it in various levels, but again, trying to parse out and tease out, really what are some of the factors that are impacting our data and informing, or kind of impacting our data, and are starting to paint the picture that we're seeing.
Thank you. Another question, how do you respond to critics who state that disparity in child welfare is a reflection of disparity of need, i.e. disparity in risk factors for abuse?
Again, that's a values question and a judgment question, and I think that's where our conversations that Jen referenced earlier in the presentation got very provocative with the folks that were sent to our statewide racial justice work group that we addressed those head on. And we continue to say that African American and Hispanic kids are not abused or neglected any more so than their white counterparts. And we look that in the face whenever people kind of use that argument in the child welfare discussion about how we view the work that we do.
Vanessa, this is Jen. Can I add one more thing to that?
Yeah.
So what I wanted to add, well, two more things actually. I'll be quick though. Two things that we've done. One is that we actually, as Vanessa said, even in the statewide racial justice work group, we would do vignettes, or we would do activities where we had, sort of presented a family and said, what would your sort of judgment, and then what would it be if the family was, we would have a black family, white family, and see and have conversations about if there were different decisions, and just be really, really upfront about some of the assumptions we would naturally make, and linked it to conversations around implicit bias, internalized racism, and the real issues that we know impact all of our decision making. The other way that we've actually had conversations, I think more explicitly to that particular listener's question, is we actually have looked along, as Susan pointed out, along all of the decision points. So I think you can make the case that if somebody makes that argument of at the initial point, more children are getting screened in because there's a higher actual incidence of, it still begs the question of, so why do the disparities grow at every time we have the opportunity to make yet another decision? Because that doesn't answer that question. So we've really tried to tackle it, as Vanessa said, from a number of different ways, ranging all from the actual decision making to going back to the data and just having more conversations about different areas of data that might lead to some different hypotheses and some different conclusions.
Okay, well, go on.
Oh, we're fine, thank you.
Okay. So we'll end there. We want to give a huge thanks to Michael and the team from Connecticut. We are truly inspired by the work that you all are doing, and we're looking forward to continuing to work with you in the Alliance for Racial Equity in Child Welfare. Just as a reminder, we will be sending the slides and follow-up recording to everyone that participated in this webinar, and it will be available for public viewing on the CSSP website. Thank you also to Janice and Joyce for helping and for your continued leadership in all of the efforts that are going on with the Alliance. We look forward to being in contact with all of you around the country, and we will be in touch with future webinars and future work. Thank you, everyone. Have a good day.
Thank you.